me start the webinar that we are having today. Ladies and gentlemen, a very good morning to you. Well, good morning from UK. So that's Dr. Shaimaa and me from UK. And Dr. Kusuma is going to be good afternoon because she's from India. This webinar is episode number 2 of the second season. So technically, this is the 12th webinar that we are doing in a series about public education. And this webinar is going to be about myths and rumors. So we've got actually 2 doctors with us. One of them is a radiologist and the other one is a psychiatrist. And me, I will be the moderator, and I also work as a psychiatrist, and my name is Amit. This webinar is a public health education initiative, and this is the first time that we are doing a webinar like this in English. And I would advise the audience that you can start sending us questions if you want with regards to radiology and psychiatry. In the meantime, if you want to talk to us or to any of our doctors, you have 2 options. Either you can use the option of live chat. So if you see on your screen where you are seeing your YouTube, so for example, this is your YouTube, just underneath that in the bottom, there is an option called live chat. So audience members can write over there and ask us questions, whichever questions you want. I would politely ask about psychiatry as well as radiology. I'm happy to, if some people are asking in Hindi, I'm happy to translate them also, so that's not a problem. The other option that you have is by a live video call also. So if in the corner of your screen on the right-hand side upper corner, you see a WhatsApp number. So you can actually send your Skype IDs on that WhatsApp number, and then you can, we will connect your video feed, your Skype call directly to this live webinar, and you will appear on the screen. So you have 2 options. So that's enough from me. I will politely ask the speakers to sort of present themselves, like to introduce themselves. So let's start with Dr. Kusuma. Dr. Kusuma, would you like to just say a few words about yourself? Where are you from and what do you do?
Yeah, hello everyone. Happy Dashara. I'm Dr. Kusuma. I am from Andhra Pradesh, India. Currently, I'm working in Kerela, Palakkad, as a consultant radiologist.
Okay, that's great. Thank you. Thank you. So radiology is, just for the audience members, radiology is the study of, so when you talk about CT scans, MRIs, ultrasound, and other scanning equipments which we use to diagnose illness. So Dr. Kusuma will be the person who will be sitting at the diagnostic center. Jumping from there to Dr. Shaimaa. Dr. Shaimaa, introductions, please.
Hello, my name is Shaimaa Aboelenien. I'm working with Dr. Amit, as he mentioned earlier, in STEM Trust. I'm a psychiatrist working in the UK, and originally I'm from Egypt.
So you're originally from Egypt?
Yes.
Right. So Dr. Shaimaa works in general adult psychiatry, which is ranging from the age group of 18 until age group 65. So for audience members, you've got 2 general adult psychiatrists on your screen and 1 radiologist. So start sending us your questions as you would like. In the meantime, because this episode is about myths and rumors. Myths and rumors, I think it's about, trying to break the general conception, which some misleading conception which people have in their mind. So I think I would be asking Dr. Shaimaa about, some questions about how to keep your mental health, like how to stay sane in this COVID crisis and all. Well, technically now it's the 2nd wave. And I think Dr. Kusuma, I want to ask you first of all about radiology. Like, what are the sort of, give me one point about radiologists which you think is quite misleading. So let's start with Dr. Kusuma.
Misleading, generally radiologist means most of the people think it is regarding radiation oncology, regarding cancer or something. No, radiology means imaging diagnosis. Like we will diagnosis through imaging technology.
Okay.
One of the common myths.
So the most common methods that you use are suppose it's MRI, CTs, and something else?
Yeah, even X-ray, we diagnose even X-rays, ultrasounds, CT, MRI, and some procedures, etc.
Okay. I think somebody's got maybe a live video feed on the side. Could you reduce the volume, or maybe if I don't know if it's you or maybe the IT guys, could you reduce the volume of that, or maybe I wonder if Shaimaa or Dr. Shaimaa or Dr. Kusuma has that. You can close the YouTube link because the voice will echo a lot. So if you're watching yourself on the screen, just close yourself. Just stick to the Skype call for now. That would be good.
I don't know.
Okay. Dr. Sharma, you can connect your video link whenever you can. Dr. Kusuma, in the meantime, I think we've already got a question. Dr. Shaimaa to appear on the screen. I will about how to stay sane in this time period.
Yeah. Is that better?
Yeah, I think it's definitely better. It's definitely better. So, Dr. Shaimaa, I think my question is for you, because being a psychiatrist, and I know you do a lot of webinars on televisions also, I think in Egypt and in Turkey, I suppose. So, please give me some tips to stay safe from my mind point of view.
Okay. First of all, I just want to talk about the COVID, and it have a huge effect on a lot of people regarding mental health. And
That's true.
It was like it's because it's something pandemic. It's not only in the UK. It's not only in India. It's everywhere, which is something we didn't experience before in our generation. Maybe very, very old people who can experience other type of pandemic, but this is the first in our generation. We have like confusion, its effect on work, physical, mental, everything. So regarding the mental health, what I really noticed initially, everyone when locked down and everyone stay at home, this is when everything started regarding the mental health being really under focus, because a lot of people start to get more anxious, panicky, depressed from what's going on around them. They can't deal with the situation. They are confused. And I have to say, even some, on the other hand, some of the mental health patients, they found it really helpful for them, because a lot of people like suffering from agoraphobia, they can't go outside. So they forced to stay at home, which is more suitable for them. So actually we have two types of people here. People are really found the lockdown and the government saying stay at home and not go outside more suitable for them and make them more calm in that sense. On the other hand, a lot of people who not adapt on this situation, were very, this is when the anxiety and panicky and being start to have like depressive symptoms. And I have to say, after the lockdown finished, after the first wave, we noticed that there is tremendously increased the amount of people presenting to the mental health service. So, yeah, I think you agree with me.
I totally agree with that, because so Dr. Shaimaa works in the outpatient setting, in outpatient clinics. I work with the crisis team. So crisis team, my role is actually like a bridging service between the inpatient units and outpatient unit. So there's such a massive increase in people struggling with mental health issues like depression, anxiety, nervousness, insomnia, that a lot of wave is coming. And bearing in mind that we are talking about COVID, I think I would like to divert my next question to Dr. Kusuma. Dr. Kusuma, what's happening in radiology from a COVID point of view? I think that this is something which I think a lot of audience members have asked us in the past. Like when you see, let's say, a snapshot of an X-ray, or when you see a snapshot of, like a CT scan sometime when you are recommending, what do you see in that? Like what happens in that case?
Pandemic is going on, many COVID cases are coming in. X-ray, maybe any subtle findings or it's not specific. So we have to go for CT. and CT is very sensitive, high specificity for diagnosing COVID. So we grade it. Is it highly likely COVID or not? We have CORAD system for that.
Okay.
So we see the COVID findings in CT.
Okay. Okay, that's great. That's great. Because just to say that we've already got questions coming in now from the audience members. And I think the first question I will divert it towards Dr. Kusuma because it is about radiology. And Jyotirmai is asking, hello, doctor. I had kidney stones previously. And first time doctor suggested ultrasound. I think USG means ultrasound in India, I suppose. And second time CT scan, why? What is the difference? So I think kidney stones, first was ultrasound scan and then a CT scan. So obviously, if in UK, I think we can sort of, justify it because we don't have to pay. But I think in a country like India, where scans do cost a lot, you have to pay from your own pocket. I think people will question stones, first ultrasound, then CT. So why? What's the difference? So Dr. Kusuma, I think this question would be for you.
Yeah, so kidney stones is one of the most common cause for abdominal pain in any emergency setting or normal internal medicine setting.
Okay.
So we suggest ultrasound first because it has very less radiation, no radiation, and cost effective. And we can diagnose most 90% of the stones in ultrasound. But if the stone is in the lower part of the ureter or mid part of the ureter, it will be difficult to localize or to diagnose. So next investigation will be CT scan. In that, we can localize, we can measure the size and the nature of the stone, whether it is calcium or uric acid stone, and depending on that, clinician can plan for the treatment. Okay. Even if you're planning for any procedure, the distance from the stone from pelvis or whether it is in the lower ureter or in the bladder, it will be easier in CT. So maybe clinician might have suggested CT.
Okay, thank you very much.
Okay.
After you, Dr. Kusuma, after you.
Even we can rule out appendicitis and any ovarian problem in females in CT scan.
Okay. No, I think you're quite right. I think just to clarify, I think Dr. Kusuma talked about body part which is called the ureter. So ureter is the sort of a pipe which commonly gets like when you develop stones, you get stuck in that ureter, and it's the pipe which connects the bladder with the how would I say, with the kidneys. Yes. So actually it's up. So from kidneys to the bladder. So yes. Yeah. That is right. Well, it's for a revision for me as well. So, Dr. Shaimaa, my next question, which is not from the audience, but I just want to ask you, I think because you are also from Egypt and because I come from India, I think there is a lot of taboo, which is I know about, I can only say about my area, which is the northern part of India, which is, I'm from Punjab. And there's a lot of taboo, which is, associated with mental illness in general. People struggle a lot to talk about mental illness. So there's a lot of stigma attached to it. I wonder if that is so the case, even in your side where you come from, and what do you do? Like, what do people do when they want to talk about it?
Yes, you're right, Dr. Amit, about this. The stigma is there, and it's more evident in our countries. Unfortunately, although we think that sometimes it's getting better and people understanding more educated about the mental health and they can speak freely about it, they all, even close people to you, and they know that you are a psychiatrist, they come to you and don't tell anyone I am seeing you. So it's a really very common thing. Even your own family, they ask you for advice, but don't tell anyone that I talk to you about that. It's as if it's a shame for them to even express their feelings, express what they are suffering from. And they are really well-educated persons. So still there and still evident in our country, our culture, unfortunately. Of course, it's less the Western part of the world, and it's people are more open to have a psychiatrist and encouraged to do and connect with the secondary service. But I can't say the same for our culture, honestly. And still there, and they are, even from COVID. If anyone get COVID, they try to hide it because it will be like a stigma they got COVID.
That is true. That is true.
So it's a lot. Don't tell anyone. And if anyone knows about this, it's like, oh, a shame, and people try to avoid them. So same for mental illness. I have to, unfortunately, I have to say it's still there and it's still evident, affecting a lot of people. Even if it's the people are more open now, but still it's in the background. Maybe a little bit better. I have to say, a little bit better, not like before. And we are trying to improve the image of mental health. So encourage people more to connect and be open about it.
That is good. That's good. And I think that is the small hope that we are also having when we are doing these webinars. We invite psychiatrists and doctors from different specialities. And I think this is, if I talk about psychiatry, this is a very common theme which we always talk about stigma in mental illness and how difficult it is. I'm going to actually divert to the questions again on the screen because we've got quite a few questions which have come on board. But in the meantime, I just forgot to say two things before the start of the webinar. Number one, if you're watching this webinar, it would be really encouraging for us if you subscribe to our channel, because we will continue webinars like this, and we are very soon going to start making health animations. So if you can subscribe to our channel, that would be great. And number two, Dr. Shaimaa will be here only for around 50 minutes. So if in India the local time is 3 o'clock, Dr. Shaimaa will be leaving in around 10 minutes to 4, or exactly at 4 o'clock. After which we will be joined by Dr. Girivar Singhal, who is an internal medicine doctor from Germany. So this webinar will continue, but Dr. Shaimaa has to leave because we got confused about timings, about the time differences which took place today. Dr. Kusuma, I have a next question for you. And first of all, Jyotirmayaji, I hope we've managed to answer your question. Next question for Dr. Kusuma is, it's actually from Dr. Kusuma. Question for Dr. Kusuma from somebody by the name of Kusuma is whether it is safe for children less than 5 years, so 5 years less, a child, to be tested by an X-ray. What sort of precautions would you, like what are the problems that happen, or is it okay for that? So Dr. Kusuma, please.
Yeah, it's a generalized question. It depends on severity of symptoms, whether the baby is having milder symptoms or very severe. X-ray means probably he or she is having respiratory problems or abdominal problems. So if symptoms are severe, yes, definitely the baby should undergo an X-ray. Okay. You can come to a primary or any basic diagnosis with X-ray. So but you should not repeat many times. You should take care. And in X-ray department, they will give you a shield to cover thyroids and pelvis. So it will be okay. You should always keep in mind that it gives added radiation in case of repeated X-rays. 1 or 2 X-rays in a year is okay.
Okay. So I think that I think a similar sort of thing which is followed even in United Kingdom, and I know this thing because I used to work. I did a rotation in accident and emergency department. So X-rays in especially young children, they are quite restricted. You need to have special reason. For example, if a child is struggling with a severe respiratory distress, like they are wheezing a lot, and you can feel that they are bubbling, the chest is bubbling. That time you have to do an X-ray to rule out pneumonia and to rule out the damage. Sometime in kids when they have appendicitis, I think that time some clinicians may feel that the X-ray is needed. And obviously, if it would be a good idea that you sort of diagnose everything with an X-ray, because the next step, which is the CT scan, that is quite invasive from a radiation point of view.
Yeah, yes.
Yeah.
So, yeah. Also CT, same reason. If the children is having moderate to severe symptoms, it is okay to have a CT.
Okay, that is great. Thank you, Dr. Kusuma. And Kusuma ji, I hope we answered your question. I think it was quite a good question about, X-ray in children. And my next question from the screen is for Dr. Shaimaa, which is about mental health. And KV, so it's initials KV. KV is asking, hello, doctor, I'm having anxiety, tension, and I get upset for long time whenever same thing negative is happening. And
something.
Just bear with me because KVG has asked another question. I'm trying to see if there is a correlation between them. Okay, so the second question down the line, which she's asked, actually is something different. So we will just focus on this question, Dr. Shaimaa, that I'm having anxiety, tension, and I get upset for a long time, even whenever something negative is happening. So would you, Dr. Shaimaa, would you give some tips? It's like dysfunctional coping skills and things, but maybe just giving a general tip to someone who, something bad happens and they get stressed for a long time.
Okay, first of all, I would ask, you have to ask yourself, is this affecting me functioning, being function, and doing my work? For how long you have these negative feelings? This is the question you need to answer yourself honestly and be honest with yourself, because if it's affecting your work, your life, your social life, and make you withdraw or avoiding things, so this is when you really need professional help. This is one thing you need to be honest, and you have to answer to yourself this question. If this is not the case, it's not to that extent, it's not affecting your life, this is when you need a psychiatrist, basically. So you need help, a professional one, so can guide you. Yeah. If it's not the case, just there's a period of feeling low or feeling anxious, that will happen again, and not affecting your function. Mm-hmm. So yes, you can either do some techniques like distracting yourself, doing things you like, make a list of things you like, for example, and make it in this emergency situation. So if you have this feeling, okay, I have a list of things I like to do, or things just a way of distract your mind about the main problem that cause you anxiety and tension. This is one of the things you can do. The other thing that if you sort a situation that make you an anxiety itself, so you can either face it or see what's the source of anxiety. You can solve it. If it's solved, so you will not have it again. Whatever this source is, a problem with your parents, problem with a friend. So the way of communication can be a solution. Just communicate and talk. So even talk about this problem, or talk with your friend about this problem, just make you have a feel of relief of the tension inside you, not accumulate this tension over and over to the point that you get burst, and you can't tolerate it anymore in a situation that you might regret later that you reached this point. So don't let it reach to this point, and act actively and solve it, so all tension can relax and calm down.
That's right.
Hope that answers.
No, I think, Dr. Shaimaa, it was really helpful. I think thank you very much for that. I think you've mentioned some point there, which I want to come back to after I divert the next question towards Dr. Kusuma. So thank you, Dr. Shaimaa, for your answer. And KV, I hope you got your answer, which you were asking with regards to this, but I'm going to try to elaborate this a little bit more. But I'm just going to divert for the time being a question from Jahir Shah Sheikh, and they are asking Dr. Kutti that is it possible for male also to develop breast cancer? And if yes, can it be diagnosed? So Jahir Shah Sheikh ji, I'll just give you a very quick answer. Yes, it is possible for male to develop cancer, especially breast cancer. But Dr. Kusuma can give a little bit more detail about it.
Yes, yes. So as Amit said, it is possible even in male. It's not just only to belong to women. It's not always cancer. A male person can have both benign and malignant conditions. Most common benign condition is gynecomastia, which means breast-like, looking like swelling in men. So whenever you feel this swelling or pain in breast, after consulting a clinician, you come to the radiology department and we can scan. Ultrasound is absolutely harmless. You can scan it and we'll diagnose it whether it is gynecomastia, which means breast tissue in men, or is just simply fat, or even they can have masses or lumps. Even that we can diagnose, and it needs to be biopsied. Just don't be panic and don't delay it. Even it can spread to like metastatize to other parts if you delay it. It cannot be primary. It can be from some other organ also, like prostate cancers can present as breast masses as metastasis.
Okay.
I hope this is
That's great. Thank you, Dr. Kusuma. And bearing that in mind, because we are talking about male breast tissue development or gynecomastia and all that, Dr. Shaimaa, I think you might be aware that a lot of the medication, they also have this, a side effect, or perhaps. So would you like to maybe give some tips about it? And because I'll add something after that. So what's your experience being in your clinics and in your practice until now? Because we check some prolactins and all that. So if you can just shed some light on that, Dr. Shaimaa.
Yeah, I would. Thank you, Dr. about this. I would just want to add that you're right about we have some medications that can have this problem. So usually when we start prescribing, especially like antipsychotic, and some of the antipsychotics well known to have this problem. So usually before starting antipsychotics or any medication we are giving to the patient, we have a list of investigation we need to do, including prolactin level, which can be like a diagnostic for us that there is a problem and we need to adjust either the dose or stop the medication or adding another one. So as Dr. Amit said, it's well known with some medication, not all of medication, but we try to do like a baseline and monitor the patients for that after time, so we can understand if there's anything happened. But most of all, that it's really important whenever the patients feel symptoms, we have a discussion before starting any medication anyway, and discuss the side effects that he can experience. So once he has symptoms, as we already explained in detail, he will contact us straight away and we will do investigation and see if it's need to adjust medication or stop the medication. So it's as Dr. Ahmed, it's known side effects with some of our medication.
Yeah, that is true. That is true.
I want to add one point to this. Even alcoholism and liver problems also can cause gynecomastia. But if we start investigating, there are many conditions which cause gynecomastia, which cause hyperestrogenism.
Yeah, and I think that is the thing. And you are right, Dr. Kusuma and Dr. Shaimaa. Jahirji, I think your question was about male breast cancer. Yes, it is possible. And obviously, if there is any sort of chance that you are feeling some sort of a new lymph or some sort of new lymph nodes or something like new lumps in your breast, or maybe something like sometimes I've even heard cases in which male person can actually start lactating as well because of some side effects. That is also possible. So the first thing to do would be to see a physician, a general physician, who can do a full screen of bloods and then can refer you accordingly. Because Dr. Kusuma said that sometime in liver issues can happen, or in mental health side when we use medication that can happen. So your physician will be able to request a full blood screen for you and see if you need to be referred to a hepatologist or maybe to a psychiatrist, because I know that some generic medications that we use like olanzapine, risperidone, so these are not brand names, so I'm not actually criticizing any company as such, but I'm just talking about general generic names like olanzapine, risperidone. Some medications which are used in mental health, especially in psychosis, they can have these type of problems, so we always try to monitor them. So Jahirji, I hope we gave you a lot of detail about your question. And next question, again, I think it will go towards Dr. Kusuma from the screen. It is by Mujir Begum Sheikh. Mujir Begum ji is asking, hello doctor, I have PCOD problem, which is the polycystic ovarian disease, I think. And can it be diagnosed by an ultrasound? And kindly advise. So that's what Mujir ji is asking. So please, Dr. Kusuma, I think it's towards your specialty.
Yeah, PCOD is most commonly seen these days when they're undergoing infertility treatment or just irregular menstrual cycle and all. So clinically, it will show as irregular periods and facial hair and obesity, maybe acne, which means pimples on the face. Yeah. So it's mainly clinical, and radiological diagnosis can support. Yeah. The other name for PCOD is recently it is hyperandrogenic anovulation, which means high secretion of androgens. Androgen is testosterone in females. Generally, a small amount of testosterone is released by female ovaries and fat cells, and that's okay, that's fine. But whenever this testosterone content is increased, it will show as symptoms. So after blood workup in ultrasound, we can see the size of the ovary and whether it is diagnosed by many number of follicles. Ovarian volume and all we take, and it's only supportive for clinical. Where if testosterone is high, the patient should take the treatment, start the treatment. Even if ultrasound report is normal, the patient should undergo the treatment.
Okay, that is great. That is great. Thank you. Thank you, Dr. Kusuma. And Jahirji, I hope we've answered your question. I think. Sorry, I think it's from Mujirji. Mujir, I hope we've answered your question. Your question was, can it be diagnosed? Can PCOD be diagnosed with ultrasound? So yes, it can. And Dr. Kusuma has already answered that. Dr. Shaimaa, I think in one of the previous episodes, before I sort of latch on to the next question from the screen, I wanted to ask you, because a lot of people have asked, what is the general treatment approach in mental health? Like if somebody struggles with mental health, how should we sort of do a step-by-step treatment for them? So if you would like to maybe shed some light on it.
Okay. So first of all, I would say, how do you know you have a mental health problem?
One more question. I'll add on and I'll sort of specify it more. I'll say, let's say depression and anxiety. Let's talk about depression and anxiety in two big categories, and then you can or either collectively, and you can tell me about treatment approach. So please, sorry, I interrupted you.
So I was just saying that first of all, you need to know if you have a mental health problem and you need help or not. So it's the fine thread between being mentally ill or not and need professional help that it starts affecting your function. So it's just affecting your work, as I said just earlier, your social life, your health even can affect your health. This means you need a professional, and you don't spend a long time to resist the idea to ask for help, because this make things worse and make things more take time to get back to normal. So the first thing, recognize or acknowledge the problem, that you have a problem, I need help. This is the first step. Okay, so as Dr. Ahmed said, for an anxiety, for example, we said about the anxiety earlier, and that's the anxiety when it starts not function, affecting your work, avoiding certain situations, not to be there, like anxious around people, so or having presentation, for example, or being in a social gathering, so you start avoid your family, avoid your friends, and stay home, isolate yourself. You can't go to work to be between your colleagues. So all of this, so you need to start to seek help at this point. I just want to assure you, we are not asking for medication. So if you are coming to us, not the first time, okay, you're coming to us, you will start medication. Sometimes people afraid of these points. I don't want to be stigmatized having mental illness and having medication for this, and I don't want to be that person. Just to assure you that we do a consultation, and according to your case, it's case by case. So it's different from patients to patients according to the degree and according to what he exactly needs from us to help him.
Yeah.
Okay. So first of all, you come to my clinic and I do a full assessment for you, taking a very detailed history about even your family history, your mental health, your physical health, everything, because sometimes physical health is like a factor that affecting your mental health as well. If anyone has like disease or something, this is eventually can cause him depression or being anxious in certain situation to avoid being embarrassed or anything like this. So a lot of things tangled together. You can't just sometimes pinpoint one single problem. So
Yeah.
you need to just sit with yourself and be clear about what's exactly your problem that you want to solve it. And then we this is what I'm doing in my consultation. First, I analyze everything, put everything in front of me, and see how best I can help you. We have like 3 options of treatment approach. We call it biopsychosocial. So we are telling you our secrets now, everyone. So when I said bio, that means the pharmacological aspect. So we need, if you need treatment, if you're really severely depressed, and this is as I said, it's affecting all aspects of your life. You need urgent help in that. However, this is be like mild, moderate, severe. Severe, when I said that there is suicidal thoughts and really endanger yourself, your life, how you have ideas of harming yourself. So we need at this point we need immediate intervention, up to asking for admission or crisis team. Dr. Amit.
That is true.
Yeah. So this is one of the way in the UK. Actually, it's not in Egypt, for example. I'm not sure about India. If you can answer this, but in Egypt we don't have crisis team, but they developed this crisis team. So it's a stage from being home, or crisis team, or admission, according to the severity of your condition or your mental state.
Correct.
So depression, for example, if it's mild, okay, you might have some medications or only psychological support. Some of the patients just need talking therapy. And, talking therapy will be enough. It's self-referral even. Having some session, they just have a sense of being calm and release of all the tension inside them, and that's it. They don't need any further interference. After they came to us, and no, you don't need all of this. You will be fine. It's just a small thing that you can solve. Just talking therapy. The other degree that we starting medication could be for a while, at least 3 to 6 months, and then we can assess.
That is true.
Yeah, and then moderate to severe when we talk about crisis team and admission.
Okay, that is true. That is true. So, Dr. Shaimaa, I'm mindful of the time because you have to sort of leave in, I think, 10, 15 minutes. From the screen, I'm going to jump one question by KV, because KV was asking one question which actually comes to the same context which Dr. Shaimaa was talking about just now. So we'll just have we'll just skip that question for the time being, but we'll come back to that. But Dr. Kusuma, I want to ask you a question by Shivani Shakti ji. Shivani Shakti is asking, I've developed gallbladder stones 2 millimeter during my pregnancy. So it's gallbladder, and severe pain and vomiting often. After delivery, symptoms subsided. Now the size is increased to 8 millimeter. Should I go for surgery? Please suggest. So, Shivani ji, I think before I even divert this question to Dr. Kusuma, my personal feeling is that I think you do need a surgical input on this one, because I think to undergo surgery, it will be decision more coming from a surgeon based on the recommendation from a radiologist. So, Dr. Kusuma, please, the ball is in your court.
Yeah. So radiologically, what we should check is whether the stone is obstructing the neck of the gallbladder, or whether it has passed to CBD, means common bile duct, which connects which connects the gallbladder. So based on symptoms only, again, whether you're having severe vomitings or pain or jaundice, obstructive jaundice or anything, then surgeon will take a call. So what we have to do is whether it is obstructing or not, whether any inflammation is there in the gallbladder, what is the thickness of gallbladder wall, whether it is functional or not, that details will give it to the surgeon. So according to that, he will plan.
Okay, and Dr. Kusuma, would you be using only ultrasound scan, or can you also recommend? I think it's because the person is pregnant, so we cannot use CT.
Yeah, we cannot use CT, and even in normal people, ultrasound is best for diagnosis of gallbladder stones, because they're mostly made up of cholesterol stones. Yeah. Cholesterol is radiolucent in X-ray or CT. We cannot see that stone. So better investigation is ultrasound. If they are having severe obstructive problems like jaundice and everything, they can go for MRCP. It's MRI investigation. So there exactly we can see the size of the ducts, main ducts, biliary system, where it is obstructing, or any strictures are there, blockage is there, whether the pancreas is normal, the pancreatic duct is normal, and all we can see in MRCP. That is not harmful. MRI is not harmful. Even pregnant women can undergo it.
Okay. That is great. I think with the MRI, I don't know how big those MRI tunnels are. Sometime I've noticed that when I think I've read somewhere in literatures that in pregnancy, because the hormone things are quite high in the body, and you are more susceptible to develop some sort of claustrophobic presentation. So if you are in the later trimester and you need an MRI, once you enter that MRI tunnel, in a way, I think you will feel very nauseous also. It can happen. So just be careful. Do the scanning only when it is needed. Thank you, Dr. Kusuma. Thank you very much for your answer. And Shivani Shakti ji, I hope you got your answer. So I think we got it quite thoroughly. I'm going to come back to Dr. Shaimaa. And Dr. Shaimaa, this might be the last question for you before you leave. And this question is from KV. KV is asking, hello, doctor. Whenever I'm slightly sick, I get worried that it is very serious. So any sort of sickness, they get worried that it's going to be very serious. And they are not satisfied until they are completely tested. So we are talking about not CT scans, but maybe having all the blood tests, all the ECG sometime. Do I need any treatment, or is there a home remedy? Thank you. So Dr. Shaimaa, I think it's on the same thing which you were talking before. So I think you just have to elaborate a bit.
Okay, the thing that it's a good question, KB. The thing that, as I said before, okay, you get tested. The thing that's a good thing you mentioned, that you are not convinced until you get tested. When you get tested, you are convinced that everything is solved and everything is fine. That's good point, and that you are that means you are not need intervention from psychiatrist. Why? The other side, if you are sick, there's two types of sickness. If you are sick or having only the symptoms, so it's like a vague symptoms, you don't know what is it about, and we call it somatization. But you don't have this unless this somatization make you feel you are having something serious, and You can't explain it what, and to the extent that affecting your life. In a simple words, all the other hypochondrias, when you have symptoms, you said, oh, I have a brain tumor, for example. It's just an example. I'm convinced, and you went to the GP. He asked for different investigation. All investigation normal. No, I'm not convinced. I have brain tumor. This is when you need intervention from a psychiatrist, because you are not convinced about the investigation is true. You still think to believe that you have a brain tumor. So this is when you see us. It's mainly psychological treatment in these cases, and sometimes we need pharmacological intervention as well. But in such cases, it will mainly the mindset that you have a brain tumor and you have this symptom. We are not saying you are. Some patients say, "I'm not lying." You're not lying. You are experiencing these symptoms, and it is affecting your life, and this is why you need help. Okay. I hope this has answered your question.
Yeah, that is true. That is true. No, I think, thank you, Dr. Shaimaa. Thank you. And KV, I just want to say that I think from the sound of it, from the way you framed your question, and if I'm looking at it, it does seem to me that you are quite an anxious person. So I just wonder, it's not like I'm diagnosing you, I'm just wondering that maybe you are already struggling with some form of mild generalized anxiety disorder. Because the reason why I say that is because when you slightly get sick and you feel the worst, and then you are not sure until it's completely tested. So basically, the negative ruminations that you have about your physical health are actually, in a way, maybe going a bit too much overboard, more overvalued ideas. And I think sometimes what happens is that sleeping in the night, you develop a chest pain, which could be because of a trapped gas in your upper stomach area, but you think it's a heart attack, and then you start calling the emergency services and getting a blood test and ECG. So I think that may not be the case, but that's why I'm saying you might actually benefit from some form of already ongoing psychological therapy, something like a CBT, in which you can sort of make a stage-by-stage plan as to what to do when you struggle with this, when you struggle with that. So that would be quite useful to do. Please, Dr. Shaimaa.
I just want to add that, just confirm your point, that you might have anxious personality. So
that is true.
Yeah, so anxious personality, when you get anxious about simple little things, others can't get anxious about it. But as I said, as long as you're functioning, you are reassured about the investigation that everything is fine. You might need some talking therapy just to address this anxiety in a right way and see how.
And there is no home remedy, I think.
Yeah. Sometimes relaxation techniques, there is what we call relaxation techniques. So when in talking therapy, they might teach you how to do some relaxation breathing exercise, relaxation techniques when you relax all single muscles in your body. So all of these techniques, it can help with anxious personality. So when you get feeling of anxiety about anything, because relaxation and anxiety cannot coexist together. So when you do this technique of relaxation, it's calm you down, and all these thoughts, the rumination of the thoughts, it's make it more calm.
That is true. That is true. Thank you, Dr. Shaimaa. And I think in India, obviously, the most common relaxation technique is yoga and meditation. I think you should get on board, start doing that. And don't forget that if you are struggling with a generalized form of anxiety, try stopping the stimulants that you use. So if you're smoking, stop smoking or reduce your smoking content. If you have a habit of drinking a lot of coffee, because I know in Dr. Kusuma in South India, they use a lot of coffee, and in India, they use a lot of, in northern part of India, they use a lot of tea. So if you are using tea and coffee, try to reduce the intake, especially during the night time. And try to stay away from your phone during the night time. And don't get educated by WhatsApp messages and Facebook Messenger messages and all that, which get circulated around, because they anyways feed into your anxiety. I think, KV, on that, I think we hope we answered your question. And I am quite mindful that it is time for Dr. Shaimaa to wish us goodbye. And Dr. Shaimaa, I want to thank you for joining us. Again, for the audience members, I just want to say that I would be inviting Dr. Shaimaa again in the future. But she has to go now because the time in Europe actually have gone before 1 hour. So actually it is totally my fault. I got confused with the timings. So it's not Dr. Shaimaa's fault. Dr. Shaimaa, thank you very much. If you just want to give us some few tips before you leave about your mental health, that would be great.
Yeah, just I would say stay safe and be aware about what exactly you're feeling, and the way, if you're anxious, if you're feeling low, don't stay for a long time. Resist the idea to contact professionals to help you. As I said, it can be as simple, just talk, and it can be helped with the medication. It can help. Social support is really important. So as I said, it's biopsychosocial. So it's a lot of things we can do to support you, and especially with this time with the COVID pandemic, it's not easy thing for everyone. As I just want to say, you're not alone. That's it.
That is great. Thank you,
Dr. Amit, for giving me this.
Thank you, Dr. Shaimaa. I will be in contact with you soon, later on during the day. In the meantime, I think what you can do is you can disconnect your Skype call that you are on. But when you disconnect it, a message will appear that you have been kicked out. So I think it's an automatic generated message. Don't feel bad about it because we are not kicking you out.
So you are kicking.
We are not doing that, honestly.
Thank you, Dr. Amit, and thank you, Dr. Kusuma, for this valuable information. Nice to meet you all.
Nice to meet you.
Thank you, Dr. Shaimaa. Thank you. Bye. Bye.
Bye.
So Dr. Kusuma, we will just wait for, So now it's just me and Dr. Kusuma, but we will be joined very soon by our other speaker, which is Dr. Girivar Singhal, who is an internal medicine doctor from Germany. And just bear with me. I'm just going to try to have a quick discussion on the phone with them. It's going to be quite awkward having this type of pause. So Dr. Kusuma, I'm actually going to, I think from the screen, we are done with the questions. Audience members, you can send us your question with regards to your internal medicine, with regards to your general physical health also, because our next doctor is working in cardiology, nephrology. So it's a mixture of all the specialties. So feel free to ask us as many questions as you want. And Dr. Kusuma, I wanted to ask you just bear with me. I have some other questions which actually came on our social media handle that I think about COVID. So I want to ask you again about COVID. Somebody asked us a question, can we detect COVID just from the X-ray itself? And why do we need a CT? Why should a person go on a sort of high exposure? Like, why would that be needed? So if you can just shed some light on it.
Okay, so everybody know that COVID is a viral infection, and its symptoms are fever associated with cough, breathlessness, and vomiting, diarrhea, and even fatigue, weakness, etc. So first we'll go for a PCR test. If it is positive, we'll go directly to CT investigation. If it is negative.
What is PCR test?
PCR test is like
polymerase chain reaction one.
Yeah, polymerase chain reaction test.
Fine. That is good.
Yeah. But we can even take an X-ray, but due to in earlier stages, COVID will be very mild. It cannot be detected in X-ray.
Okay.
But if patient is very much symptomatic, it's better to take a CT. Even PCR test is negative. Despite of that, if you take CT, you may find features of COVID. Then it is a problem solver. And the role of CT is to divide the patients into mild, moderate, and severe. also prediction of progression, how it is progressing or not. And after disease is, after you are recovering post-COVID, how it is, like whether it is completely cured or anything, any fibrosis is there, post-COVID complications are there, that we can check in CT. So, but X-ray is not so specific. It might show some features, but we cannot tell exactly it is COVID. So CT is more has more sensitivity and specificity towards COVID. Of course, with along with PCR test.
Okay, that is right. Thank you, Dr. Kusuma. I just want to actually add one thing that I think you might have heard in the news recently that there is a discussion going on about long COVID. I think it's a very common thing about long COVID. I'll just give you an example that I have a colleague who is a nurse on one of the wards, and she's a very dear friend. She developed COVID sometime in March, April. So she was off initially for 2 weeks. Afterward, what happened is she got well. So she got admitted originally to the hospital because she was quite unwell. She was saturating at, I think, 65 to 70. So she wasn't taken to ITU, but she was just hospitalized on a normal internal medicine bed. She got out after feeling a bit better, saturation improved, but she has since then struggled with weight issues, not having a good appetite. She constantly gets this cough. So she's struggling with a bad cough for a very long time. And that cough has actually varied from a dry cough to even, one which is quite purulent in a way that it is having a lot of phlegm. Kharash. So she actually just recently did a test, and what they found out is that she's developed a pneumonia now secondary to Haemophilus influenzae, so which is another on top bacterial infection. So COVID thing got recovered, but the lungs were in such a bad state that other secondary infections have started taking place. So I think that can happen. I wonder if Dr. Kusuma, you've sort of seen cases like this before.
I haven't seen, but it is possible that super infection is always possible. Like when already the patient is having COVID or already patient is having TB and he might get infected with COVID also. So it's super infection. Two infections coexist in same time. And another thing is, whenever any viral infection after recovering, the immunity will be reduced.
Yeah.
So there is a chance of getting other infections after recovering from any viral infection.
That is right. And I think we have a speaker also on board with us. Dr. If you can, you have to switch on video camera. If you.
Hi guys.
Hi, Giri.
Hi, Kuti. How are you?
I'm good. How are you?
Just before we start doing the introduction, I just have to sort of tell the audience members that myself, Dr. Girivar and Dr. Kusuma, we are from the same university, same batch. So we are all batchmates. And I think that is why it's quite easy for us to, have people coming in and out like this. Dr. Girivar, thank you for joining us. Thank you.
Okay.
Dr. Girivar, you might have to position your camera a little bit so that you are in the center of the screen. You can, something like this is better. And you have to, your forehead is cut, so you have to take it a camera a bit in. Much better. Thank you. Okay, much better. Thank you, Karthik. Thank you from the IT team. Thank you. So, Dr. Girivar, now that you've actually joined us, Karthik, you can disconnect the screen sharing, please, if you can. And thank you. Dr. Girivar, I think we'll jump straight to a question because somebody already asked a question. And that is Naidu Madhvi. She's saying, good afternoon, doctors. she had a fall in the bus at the time of journey because of a sudden brake by a driver. Right leg at knee. So she got an injury on the right leg at the knee level due to this, but no swelling. And she is suffering from inside pain. So she's experiencing some sort of pain inside. What is the reason and what could be the pain relief? So I think I will let Dr. Girivar and Dr. Kusuma answer these questions, because Dr. Kusuma, I think we can also suggest some sort of radiological investigations here, and Dr. Girivar can actually shed some light about, if any sort of pain relief is needed. So a bus journey, sudden brake, injury to the knee, there was no swelling, but the pain is inside. Please, Dr. Girivar, you can start with that.
It can be meniscus injury, sudden of break, and can be jerk on a meniscus knee, and it happens to so many people, like jumping around or something like car accident. They mostly get injured by doing the brake or doing the accelerator. So no need to worry, but you have to take an examination, something like an X-ray or something like an MRI may be needed. First, you have to consult your orthopedic. But I can tell you, I'm not orthopedician, but I can tell you that treatment, like pain relievers like ibuprofen, you can take it, but if you take ibuprofen so oftenly, then you have to take omeprazole or Pantop 40 that you easily get in India. Otherwise, paracetamol and diclofenac, and these are the painkiller which can give you relief. But first, I'll consult you to do orthopedics. That would be much better. So,
no, I think you're right. So, Madhviji, Naidu Madhviji, I think your question was that what can you do? So that is true that the injury which you have, it's more like a soft tissue injury. And I think soft tissue injury, it could be either injury with the tendon, injury with the ligament, injury with the meniscus of the knee, or injury inside the articular joint itself. So, Dr. Kusuma, can you suggest some sort of preliminary investigations for Madhvi Naidu?
Yeah, okay. We don't know what's her age, if she's below 40 or above 40. Depending on that, maybe already she might have degeneration of the knee, which means age-related problems. So first line of investigation will be X-ray only. So in that we can rule out for any subtle fracture or any degenerative problems or any other pathologies, osteoporosis and all. So next investigation will be MRI. As you both said, Dr. Giri and Dr. Amit said, to rule out any ligament tear or meniscal tear or any fluid is there in the joint space, whether it is infected or any blood is there, anything. So the bone outlines also you can see in MRI. So
that is true. That is true. No, that's totally right. So, Naiduji, I think we've tried to answer your question, and I'm sorry that you are still struggling with this pain. But yes, taking some sort of pain relief and getting some sort of X-ray done. I also suggest that you could actually contact a physiotherapist, because sometimes physiotherapy, they can actually pinpoint the soft tissue injury and try to recommend you some exercises as well for that. Because Dr. Girivar has just joined us, I'll sort of recap that if audience member want to ask a question, they can either type in the live chat option, or if you want to do a video chat with us, like we are talking on the screen, if you want to do that, in the corner of your screen, you have a WhatsApp number. Send your Skype ID on that number, and we can connect you to one of our doctors, and we can try to discuss your case. With that, I think I'm going to bounce my next questions toward Dr. Kusuma. Dr. Kusuma, Nasiruddin is asking that he was diagnosed with tuberculosis. And after tuberculosis, they used FNAC, which is fine needle aspiration cytology. but CT doesn't give a right diagnosis. Are there any sort of specific reasons why that can happen? So it's a case of tuberculosis. They did an aspiration biopsy and then CT scan. What's happening there?
Yeah, I think you meant FNAC from any lymph node, maybe lymph nodal TB.
Okay.
So in any investigation in radiology, whether ultrasound or X-ray or CT, we try to describe a lesion, the size of the lesion, nature of the lesion, how it is spreading or not, whether lymph nodes are swollen. So we try to describe the lesion. And finally, we try to give some possible diagnosis, one or two most likely diagnosis, less likely diagnosis. So final diagnosis can be done by pathologists through FNAC or biopsy.
Okay.
So 90% of the time we match with the pathological diagnosis. Sometimes we may not, but our job is to describe the lesion properly, like lesion or any pathology for that matter.
Okay, thank you, Dr. Kusuma. Thank you very much. Dr. Girivar, I want to ask you about, we were just discussing before you joined us about the long COVID, like some people developing a long-term coronavirus illness, in which it's not just finishing, like the infection is not just clearing up in 2 weeks or 3 weeks, it's taking actually 2 to 3 months. And have you sort of noticed in Germany any sort of cases? But I'm aware that in Germany, anyways, it's one of the best medical systems in the world. So I wonder if you've sort of came across any sort of long COVID cases.
Long cases?
Like in which people have actually stayed with the symptoms or in a hospital for such a long time.
It's happening right now also. Well, a patient who had a COVID and who has been recovered from the COVID, like from the ICU station, and they went home, but again now they're coming back with multi organ
failure. Yeah.
Yeah, exactly. And the more higher risk people are like asthmatic people, COPD people, heart failure patient, and diabetes and hypertensive patient. Now they are getting more worse, and the situation is getting also more worse. But what can I do? The problem is like the patient who had already COVID virus, now they get reinfected. There are no any antibodies in the body that who can protect them, and the patients who are risk and age factor, like age factors also not it does not matter now, because the 45 years old, 40 years old patient, I've seen that like they had first of all they had a minor symptoms, now they are getting more worse symptoms with exactly due to like they are on higher risk asthma or COPD. At the situation are going worse in Germany now.
Okay, that is great. Thank you, Dr. Girivar. Thank you. And Dr. Kusuma, first of all, Nasiruddin, I think we've answered your question quite a lot in detail. And my next question would be for Dr. Kusuma. It is from Neha. And we have a question. Just bear with me. Hello, doctor. I just wanted to. So Neha ji is asking that I just wanted to know how to deal with one-sided leg swelling with dull pain in the calves. Oh, so Neha ji, I think already, she's sort of wondering about DVT, deep vein thrombosis. So Dr. Kusuma, what are the possible treatment options that we have? Well, diagnostic options that we have there.
Yeah, so one-sided leg swelling can be maybe due to arterial cause or venous cause. Arterial meaning from heart to the extremities, and venous from extremity to the heart, the blood vessels. So in arterial, in radiologically, in ultrasound, we can do arterial color Doppler or venous color Doppler of the extremity. So in arterial, we can rule out any blockage is there, or if he's a male person, if he's smoking, there are high chance of plaque formation. And if if he's having dyslipidemia or anything. So in venous, we have to look for any thrombus formation, blood clot. It is whenever you are having a long travel history, or you have a flight journey, or you're a bedridden person, or you're obese, or you have to stand for a long time, then you might have this DVT problem. So with the ultrasound color Doppler of venous system extremity, you can diagnose this problem.
Okay, thank you. So Neha ji, I hope you got your answer, but I think I'm not sure if you are home or if you are already in a hospital or wherever you are. The thing is that if you are having this one-sided leg swelling with a dull pain in the calves, then it could potentially be an emergency. So if you're in a hospital, tell the doctors which are taking care of you, or tell the nurses which are taking care of you. Or if you are home and you've developed this, then I think it will be worth going to an emergency department, because you need to clarify, you need to sort of rule out this deep vein thrombosis, which is like a clot that can happen. And the treatment is not so tricky, because you will be given a list of, a combination of anticoagulant medication, something like blood thinners. So you can use that. And I hope, Neha, you get better soon. I think I've lost my screen, which was on. Just bear with me. I'm going to try to reconnect it. Right. My next question on the screen is from Azu. Azu is asking a question to Dr. Kusuma. And the question is that my 3-day-old daughter, so it's a 3-day-old. So, well, first of all, Azu, congratulations very much for the newborn in your family. I hope you have a wonderful life with the newborn. And the 3-day-old daughter is yet to pass his motion, and consultant for asking to undergo barium enema. How it will help to know issues she's having. So, Dr. Kusuma, I think they've asked especially, with your name there. So please, if you can maybe just shed some light on this. So 3-day-old baby and, not passing the stools and asking for barium enema.
Yeah, so the baby might not be passing motion because of any obstruction at any level, whether maybe small intestine or from gastric level or from large intestine. So with the help of barium enema, we can see the level of obstruction. Most common is duodenal atresia or ileal atresia, or any microcolon, which means smaller colon, or a megacolon, or sort of things. So it's a good investigation to rule out obstruction at any level for newborns.
Okay. That is good. So I think, Azuji, I hope your daughter gets well soon. But I think barium enema study will definitely help the clinician, the pediatrician, to rule out a lot of ongoing health issues. And these ongoing health issues, Dr. Kusuma has just summarized, can be quite serious also, especially if they are related to the lower end of the bowels of the intestines. So I hope your daughter gets well soon, and I think it would be a good idea for them to undergo this scanning. With that, I think we are actually quite done with our questions that we had on the live side. Our audience retention has also gone down. So, Dr. Kusuma, before we close, would you like to give some tips for people during this pandemic? Some take-home messages.
Take-home messages regarding COVID, I would say use mask wherever you go, and use sanitizer. This everybody might be knowing till now. The problem is whenever you are meeting any friend or any any close friend or anything, you immediately drop the mask and start conversing. Even friend can give you COVID. Do not forget that. Yeah, friend or relative or anybody. It's like in India, it's like for a respect, you just drop the mask whenever somebody's conversing in front of you. So that's the most dangerous part of spreading COVID. And in radiology, I would say, yes, males can get cancers, breast cancers, and ultrasounds are absolutely safe for pregnant ladies. Do not postpone your examinations. Always attend on time. No, don't fear about COVID. Take your appointments correctly and seriously.
That is great. That is great. Thank you. And Dr. Girivar, would you like to give some last takeaway home tips?
Some takeaway tips like eat healthy. And
well, before you do that, sorry, I do apologize. Before you do that, we just had the last minute question appearing on the screen, which actually, Dr. Girivar, is for you. And after that, we won't take any more questions. Would you be happy to answer that? Would you be okay? So it is from Abhishek Bhartiya, and Abhishek Bhartiya is asking that, hello, I often have acidity. Any permanent solution to acidity?
Yeah, it's a good question. Like most of the people in India, they have a acidity problem. First of all, we have to change our diet plan, and second of all, you have to consult a gastroenterologist. It might be possible that you have a chronic gastritis, which is in your stomach, the stomach irritates, and that's why you have an acidity problem. So I would suggest you can start with pantoprazole treatment, but first of all, you have to avoid this oily and late and spicy food. And second of all, you eat lots of yogurt. And third of all, you consult your gastroenterologist so he can do the diagnostic gastroscopy. So and he can take the this kind of material from your stomach, and we can send to pathology if there is any bacterial infection like Helicobacter pylori. It is like 90% of the world of the people, they have a Helicobacter, but some people get reacts from the Helicobacter, so they can manage a one week antibiotic therapy and it will resolve your problem. So I would suggest when if you cannot go to gastroenterologist, so you can start pantoprazole. 40 milligrams, like in 1 week, you can take 2 times a day, and then second week and 1 times a day, and the third week you can reduce your doses at 22 milligrams to 1 time a day, and maybe it will help you if you cannot go to your gastroenterologist. But if you can, then go to the gastroenterologist. He will help you with the gastroscopy and change your diet plan with no late food, no spicy food, and eat lots of yogurt in the evening, and it will help you more with this treatment.
That is great. That is great. Thank you, Dr. Girivar and Abhishek Bhartiya ji. I hope you got your answer, and I think yes, Dr. Girivar is right. Lifestyle changes are quite important for acidity. Instead of getting treatment, for example, with medication, if you can avoid that treatment side and go for the preventive side, that would be the best thing. Dr. Girivar, now again coming back to you, would you like to give some take-home messages for people during this time?
As I say, eat healthy, the first thing. Do exercise, walk, and avoid contacts with lots of people. Avoid contact with going clubs and pubs, and stay very healthy, and that's it.
Thank you, Dr. Girivar. So, ladies and gentlemen, I would like to close this webinar, and just to give you a highlight for what is going to happen next week. Next week, we are going to do something quite different. Our next webinar will be in Hindi, and it will be at 3 p.m., 3 o'clock in the afternoon, India time. And we will be joined, because of popular demand, by an Ayurvedic doctor who's already appeared on our show before, and that is Dr. Manali Bhartiya. And we will be joined by a yoga instructor from Germany, which is Monica Kumar. And I think it would be a great combination of yoga and Ayurveda. So don't miss out on that webinar next week, again, 3 o'clock time, India time. Until then, stay safe, take care of yourself and your family. And from I'm Amit Sharma from UK. I'm giving you a very heartiest wishes for a happy Dussehra. And namaste from my side. Dr. Kusuma, thank you for joining. Dr. Girivar, thank you for joining.
Thank you for inviting me. It's a very nice session I had. I hope it's useful for patients or general public. It's very nice initiation done by you and all our friends.
Thank you very much. Thank you very much.
To be part of this.
You are more than welcome to text me whenever you want to join it in future, because I think it will be always good to have radiology team on board as well, because we like to do these type of webinars. We will continue these type of webinars, and some of our friends, like some of my colleagues, are already on standby. Like, for example, Dr. Girivar coming at the last moment. We also have a neurologist on standby all the time who are actually listening right now to this conversation. So thank you very much.
Ask Dr. Akshay to participate.
I did ask, but we won't say names. Thank you very much. Can I ask Karthik to disconnect our live feed, and we'll continue with the Skype call?